Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome, everybody. Thank you so much for joining us today on ISLA's Back to School with Omicron. Like, we really don't want to be welcoming back to school with Omicron, but subhanAllah, this is how it is, right? What we're actually doing is we're coming back to school. We're welcoming all of you guys, inshallah. And Omicron happens to be something that is, playing a major factor in how we're thinking about how we're going to be welcoming back our students and staff. So Jazakumullah khairan, thank you so much for joining. I know that many of you are still in the midst of vacation. You might have some plans already established for how you're going to be dealing with this new variant, but it's really taken a lot of the United States by surprise. If we've been paying attention to the rest of the world, we kind of knew it was coming, but maybe hoping it wasn't. I think that's what we've been doing every year. But I really appreciate you all joining us. I am not going to take too much more time. Just want to introduce myself. I'm Shaza Khan. I'm the Executive Director of the Islamic Schools League of America. Many of us know each other. I really appreciate you being here. Some of you are new administrators or just new people who I haven't met yet. So I invite you to please reach out to me at any point. I'd love to talk with you, get to know about your role at your school and any way that the Islamic Schools League of America can support you. ISLA has been a member of the National Muslim COVID-19 Coalition for over a year now, I believe. And one of the great byproducts of that involvement is that we've been in touch and in communication with many of the wonderful medical professionals who are also part of that organization. So we're really happy to have Dr. Anam Tariq and Brother Shafiq Ahmed joining us today as panelists to speak from their expertise about this new variant and share with us. We'll give them about 5 to 7 minutes each. And then after that, I'm really interested in learning, and I think that you all must be interested in learning from each other. What are you doing to open your schools back up in a safe and healthy way, inshallah, to maintain the safety and health of your school community? And if you are a school administrator who is willing to speak about that, please private message me in the chat here so that I can know to give you some time and space. And of course, we'd also like to give some time for question and answer. So what we'll do again is we'll start with the panelists, about 5 minutes each person. Then we'll do some question and answer and some sharing out. We'll see what kind of happens more organically. So without further ado, I would like to introduce our panelists. I'm going to read their bios, each of them, and then I'll let them speak. So Brother Shafiq Ahmed, Brother Shafiq, I think I pinned myself, so let me just unpin myself. I don't know how you guys are looking at this. Okay, maybe I am not. Yeah, remove pin. All right, Brother Shafiq, Assalamu alaikum. There he is. Brother Shafiq Ahmed has over 10 years of experience supporting healthcare data analytics, infectious disease surveillance, and managing large-scale projects as a subject matter expert. He has supported Defense Health Agency, Navy medicine, and quantitative and qualitative health research, and is additionally supporting pandemic preparedness with Health and Human Services. Brother Shafiq holds an MS in public health focusing on microbiology and emerging infectious diseases. He's going to be our first speaker today, just providing some basic information about Omicron. In addition, we have Dr. Anam Tariq. Assalamu alaikum, Dr. Anam. Dr. Anam Tariq is a dual board certified nephrologist, internist, and epidemiologist from Johns Hopkins, Maryland. She was awarded a grant from the NIH, National Institutes of Health, for research on nutrition and metabolomics. Oh, great. I didn't practice all these words. And cardiovascular disease and the kidney disease populations as a clinical researcher and educator. She continues her academic teaching at George Washington University in Washington, D.C. Mashallah, Dr. Tariq has done a lot of volunteering and service work in her medical professional as well. And we're really happy to have her joining us here as well. So Brother Shafiq, we'd like you to go ahead and get started with sharing some basic information about Omicron and what do we need to know about its transmissibility, its impact on the pediatric population in particular, and other kind of updates that you are aware of that you can inform us about right now.
Sure. So Omicron is a variant that kind of popped up over the last few months, and it was initially discovered in South Africa. There were labs that picked it up there. And one of the things I want to be cautious about, and this is why it's actually being named Omicron rather than um, the variant from where it was identified, because there's that sense of stigma to it. So when Delta was first identified, it was actually identified in India. And so to avoid it from becoming the Indian variant, which would bring about a lot of stigma, which we've seen throughout this whole pandemic, starting with the former president calling it the Wuhan virus, where it was, first identified. So while it was identified in South Africa, it did not mean that it originated in South Africa. The actual origins of this variant may have come from somewhere in Europe, but I'm kind of going besides the point. But I want everyone to be aware of that the reason they moved away from naming it from a geographic location to Greek lettering is because of avoiding any stigma against any peoples from a particular nation. So the Omicron variant, was identified in South Africa. There's good news, bad news about this variant. The bad news is that this variant is much more transmissible, meaning people can become infected with it a lot faster. It transmits between people a lot faster, and people can either be asymptomatic or symptomatic and can spread it to other people a lot faster than the Delta variant. So you're probably wondering, well, oh, Shafiq, that's terrible news. What's the good news? The good news is that compared to the Delta variant, which we saw was much more severe, causing increased hospitalizations and increased death, the Omicron variant is not as lethal and is not as severe as the Delta variant. So, does that mean, we're safe? Not necessarily, because of its high transmissibility rate. The things that we have seen is that people who are not vaccinated, they are coming down with severe symptoms and are being hospitalized. People who have gotten 2 doses of the vaccine have had coverage, and but still can be infected with Omicron and have symptoms. The 3rd booster of the Pfizer vaccine has shown great promise in that it has stronger protection in preventing severe symptoms and preventing hospitalization due to the Omicron variant. So those are some kind of like facts and things like that. Full disclosure, I actually had gotten my booster about 20 days ago, and then 5 days later, I tested positive for COVID. And you'll probably hear me sniffling and coughing a little bit. So alhamdulillah, I'm much better now, but there are still some things that are, bothering me at the moment. Just, really quickly, I want to wrap up with additional facts about the Omicron, is that while most of you are educators and are dealing with, children to teenagers, you will see a lot more cases in pediatrics in children, only because, again, vaccine requirements are for 5 and up. And so younger children will be able to either catch the variant and spread it to others. So that's why it's important for us as adults to be vaccinated and have protection against this variant, so that while younger children are not eligible to get the vaccine, those who are in elementary and middle school and high school children and young adults can get the vaccine and get that same level of protection against these variants. And lastly, I want us to also consider the fact that because both locally here in the United States and globally, because vaccination rates are not as high, we can expect more variants to pop up. Right now, the Omicron and Delta variant are at a 50-50% transmission here in the United States, meaning half of the people who are either symptomatic or asymptomatic with COVID and have tested positive are either Omicron or Delta. So it does not right now, and Omicron is actually moving faster to become the more dominant variant. So what that might mean is that Delta might slowly disappear. We may not hear about it even more, but it may still circulate. But the fact that, as people are not getting vaccinated or do not have protection against this virus, there are more and more possibilities for the new variants to pop up, and it might be even more severe or even less severe. So it's very hard to tell. It's not, the predictability of it is very uncertain. It's just how these viruses mutate within the human body and then transmit to other people. So while we are, somewhat thankful that Omicron is not lethal, is not severe than the Delta variant, that's something that we can be, give thanks to Allah for. But we also have to be cognizant of that there are potentials for us to see in the news a different variant pop up somewhere else in the world. So, and I'm sure Dr. Tariq is going to dive into it, but my last point is, please get vaccinated if you're able to. Encourage your family, your friends, and other fellow educators to do the same. Thank you.
Great, thank you so much, Brother Sharik. Dr. Anam, can you speak a little bit to, first of all, the impact of this on the pediatric population? I know that Shafiq has spoken about that in relation to the vaccines. Is that the only reason that it seems that they're being admitted and getting this more? And also, what are some mitigation strategies that you're recommending? And after that, we'd like to open it up to our administrators and educators who have joined us. And feel free to use the chat to ask questions as well, guys.
Welcome, everyone. Thank you, Shazza. Thank you, Shafiq. Wonderful introduction. So most of us hear the news, and I think the reason why I love this type of meeting that we're having today is because we want to hear from you. What are the things that you don't understand and the gaps in terms of understanding? Because there's just a lot of medical terms that are being thrown out everywhere, CNN, whatever news outlet you guys watch. And I think it's just important to understand, like, what do you not understand and why are you worried about your students at your school? So I really agree with what Shafiq just mentioned. Omicron does transmit very fast, which makes it sound very bad. But the idea is that it's a mutation. So every virus learns to be smart, and it's going to evolve and learn how to become faster and better in terms of its machinery when it goes from one person to another. But mashallah, like, honestly, it is a blessing. Allah subhanahu wa ta'ala really has put this in a blessing for us, that even though it's fast, it moves from one person to another, even among people who may be vaccinated and got boosted. Those people may not have like the severe type of disease, which means that they will not get hospitalized. They don't need oxygen. They don't need to end up in the ICU. So those are good things. But then the problem is, well, what about the people who are unvaccinated? So yes, there are adults who are unvaccinated, but I think the biggest concern for me as a mom and also somebody who has a child who's under the age of 5 is that my child cannot get vaccinated right now because obviously it's not approved for kids who are younger than 5. So in order to protect them, the idea is, how can we keep them safe when people are around us? And I think the part that I want to echo again is, inshallah, I'm hoping that the pediatric population, or as we say, the child population, they don't get severe disease, which has been shown in the data. And that's, again, a blessing from Allah subhanahu wa ta'ala, but they can get the virus. And so I think it's important to understand, like, okay, if they can still get the virus, A, what am I looking for? Am I looking for symptoms? Or B, am I just going to start doing precautions? And if I am going to do precautions, am I doing the same precautions that I have been doing in 2020? Thankfully, 2021 has not been like 2020 where we were in lockdown. So alhamdulillah, that's another blessing. I feel like we should always count our blessings before we go into like, the really negative and bad things. But, in terms of keeping the kids safe, that is going to be the focus of our topic today. So I would like to, instead of giving answers first right away, I want to hear from other people what they feel like are the concerns and what are they doing in order to help facilitate this. One thing that I will point out before I stop discussing is that there have been schools and counties that closed due to the rising cases of COVID. While that is totally appropriate, and I feel like that would be a very good safe measure, I think the other limitation that we're going to run into right now is that we do not have a lot of testing available at places. So that is going to be another challenge for most of us who are on this call. And I think those would be good questions to just go over. So Shaza, I'll hand it back to you.
Yeah, thank you so much, Adam. I do see a couple of questions here. And then Aziza, I do see your hand raised as well. So let me ask these questions in the chat, and then Aziza, feel free to unmute after that. Sister Heba is asking, from a medical standpoint, what do you suggest schools do in order to return to school safely after winter break? A lot of families are been traveling and gathering. By safely, she means mitigating the risk of transmission while reducing the probability that positive individuals are on campus.
Go ahead, Shafiq, you want to say something?
Oh, no. I mean, so I think that's all dependent on also what localities are saying about schools. So whatever local school jurisdiction is doing, I would say, do your best and see if your school can, follow those recommendations. I think it's important that families who are returning from vacation have followed the same testing guidelines that the CDC put out a few weeks ago in terms of if they're coming from overseas, that they get tested within 24 hours, as well as encouraging parents, families to understand that if their child or anyone in their family starts to show signs or symptoms of COVID, that either they're pulled out of school and isolated and go and do and be in a virtual setting until until the symptoms subside. I know the CDC has issued a statement saying that it's 5 days of isolation, but it's also again, there are some controversy over the new guidelines, but following the CDC guidelines will help to identify and stop any sort of potential outbreaks within your schools.
So the new CDC guidelines are 5 days of isolation if you're showing symptoms and positive?
Correct, yes.
Okay.
We can share the link with you again, Shaza. And I think just to add to that is, the recommendations nowadays is that you get the first 2 vaccines of the mRNA and a booster to help protect you, right? So if some family member has gotten the first 2 vaccines, but they haven't gotten the booster, ideally you're not protecting your family or your kids. So that's one thing in terms of keeping everybody safe and making sure that when they're coming back from the holidays, that they are following in a sense like what the other safety measures could be in terms of protecting other people. But then the other thing would be, obviously, if you got the Johnson & Johnson, that you can do a mix and match and then add it to another booster, which would be great. For the CDC guidelines, what they're recommending is that because we know that the surge, meaning the number of cases, is going up, a lot of healthcare workers who are already, boosted even, are getting COVID again. So for them, it's to help them understand, like, well, can I work or can I have my family go safely back to school? And the idea is, if you are vaccinated and you are boosted, you can actually just quarantine for 5 days. And if you cannot quarantine separately, meaning like you're living in a household with other people and you still obviously have to share the common spaces, just wear a mask for at least 5 days so that you're protecting yourself and you're protecting the other people. And that's to help lessen the case that other people could also get COVID in a sense.
And then, should they get tested before they stop isolating and go back?
Yeah, so Shafiq said this earlier. So the testing is a very interesting concept, right? If they're coming from overseas, the idea is you should get a test right away, because we want to see, did you get COVID during the plane or did you get it at the airport? But sometimes when you're traveling within the United States and visiting other people and you come back home, you might not have the symptoms right away. So normally people say, wait till you actually get the symptom, or if you feel something different and then test, because sometimes if you test right away, it might actually be negative. And I also want to point out something very specific. For all of the schools, PCR testing is a lot more important than rapid testing. Rapid testing can actually be negative. So if you want any of your students to come back, or you feel like something is precarious, like meaning somebody in your classroom does have COVID, but you're not sure if the other students have it, a rapid test might not actually be helpful because it might come out negative, and then you actually might, put those kids back in the school, and then they're going to spread it to other people. So in that case or situation, PCR testing would actually be more important and required.
Okay. I'm just trying to take notes here in the chat. Welcome anyone else to do that too. So rapid test is not as reliable. PCR testing is more reliable. I do see Sister Tamara's question. I think Sister Tamala's question. Yes, all virus mutate. That's why they've been around for thousands of years. Will we need 4, 5, 6 shots as this continues to mutate? Is this going to be like the flu vaccine?
So just to kind of mention that people have been talking about that COVID might be the new seasonal flu, and that annual vaccines might be required. I don't think we're at a point where we can make that decision definitively. Yes, you are correct that viruses do mutate and have mutated over thousands of years. I recently taught a quick little course with a friend of mine about the importance of global health and infectious diseases. The importance of vaccines are key to containing and preventing further mutations of this virus. One of the only viruses that humankind has been able to eradicate is smallpox, and many of us may not even remember what it looks like. You'd have to look at history books or look at Google search it, but it was a devastating disease that affected the human population for a couple hundred years. And then in the 70s there was a massive vaccination campaign to vaccinate every single person on Earth. And while it took over a decade to do it, it worked very well. And that's why we don't have smallpox anymore. Now, I'm not implying that by vaccinating everyone with the COVID vaccine is going to eradicate this disease, but it's going to help contain and prevent additional mutations and further spread of this virus within our schools, within our communities, and things like that. We're all aching for this return to normalcy, what life was. And the challenge is that things aren't going to be the same, because we have to live with this virus that's is affecting our day-to-day. And it means masking up, wearing K95 masks. And I think that I saw a question here about, with Omicron being so transmissible, do cloth masks work? And should we be wearing K95s? Now, the answer to that is K95s are the best way to, filter out the virus. But, again, when places don't have the resources to get K95 for all their students, cloth masks do just as well. They do well enough. So there are ways to, some cloth masks have you can put in filters, and that may help, reduce the transmissibility of spreading the virus.
Yeah, I really like that question. So the cloth masks are still okay. Cloth mask with a filter is better, and 95 is the best.
Yeah, but I wanted to add to that. So there was a really good research that's being done right now where they had like a dummy, and then they put these different kind of masks. Maybe I can share. It was also shared on CNN. And they kind of tried to have the dummy cough to see how far these, cough particles would go in the air. And cloth masks, while they were working very well, it still seems to spread farther. So the idea would be that you would have to layer. So if you are going to do a cloth mask, you can do like a surgical mask and then again, do a cloth mask on top. I wouldn't just recommend doing a regular cloth mask. Now with kids, obviously they've become very good at wearing the masks at times, but I've seen most of the kids just wearing cloth masks. So to help with that strategy, what I would recommend your schools is making sure you have a HEPA filter system already insulated within, the air situation, whatever it's going on. If you live in a nice warm area, please open the windows. Having ventilation that's just from your windows or from your fans is a great way to keep the air moving so that it's not just in one area. Because the idea is when somebody, even if they don't cough, even if they talk to you, like I'm talking to you right now, I'm talking to my computer, but I'm sure like I'm breathing into my computer in a sense, right? So when you're having normal conversations with somebody at school, it's the same idea. If you're standing close to somebody and you're wearing a cloth mask, you might still be able to spread something, even if you're not coughing. So having ventilation is very important. Having the type of mask is also important. One thing that you could do, it hasn't really been like fully, I guess the word is researched or investigated. I don't know, Shafiq, you can ask about this or advise us too, is that if you take your surgical mask or your cloth mask, right, you can put it into the sun and let it get heated to help kind of air dry in a sense and kill off any bacteria, and then like reuse it after 24 hours. So you can reuse those things. The good thing about the cloth mask is that you can actually wash them. So if you wash them in like hot water, you can help kind of take away the bacteria or the viruses too. But that's just another suggestion, because I know some people might ask about like, well, how can I keep on cleaning? Do I need to change my mask every so often? Yes and no. The mask is there to help protect you. So if you feel like you saw someone coughing, then probably it's a good idea to change your mask. But if in a regular day, no one was coughing and no one was really sick and you were using it, go ahead and put it out in the sun, let it get some heat, or just leave it out for 24 hours, you know, in your garage or something, and let it just catch some air so it can kind of go away.
I really appreciate that, because that was my issue with getting those masks for my kids. I was like, you know, they're adding so much waste. I mean, I want to protect them, but okay, I'm gonna stop talking. Aziza, you've had your hand raised for quite a while.
Yes, assalamu alaikum. Dr. Tariq sort of addressed this, and someone else brought this up in the chat. So we were going to, because in LA we're backed up about 2 or 3 days as well with the testing. One of our, mitigation strategies was to just buy bulk rapid tests for the kids when they come back. And since they aren't as reliable, now we're like, okay, so what do we do? Because the testing takes 2 or 3 days. And so what do you suggest we do? Should we just wait until 2 or 3 days for the results with the more reliable test, or try to use a combination of both?
And Aziza, I'm going to add to this. I mean, this is a real problem. And somebody else mentioned this too in the chat. You know, it's not just right now before school starts. Okay, so if that's one of the strategies that the schools are using is, okay, we're going to have everybody get tested. We're going to do rapid testing on site, for example. Some of the schools are doing that. Those aren't as reliable. That's one issue right there. The second one is what, and you mentioned it, Dr. Tariq, when students are symptomatic, or you had a COVID positive case in your class, or 2 in your class, let's say, what are you going to do every single time? You're going to take everybody offline, and that's very, very exhausting for the teachers and for the school system. It's not sustainable. The teachers are leaving. They're not staying. So what do you guys suggest?
If you don't mind me jumping in really quickly. So while the rapid test has some flaws, I wouldn't dismiss it altogether. Aziza, you mentioned, doing a combination. A combination would be a good strategy to have. So one of the things that is part of the federal funding that came out a few weeks ago was that to provide everyone with these rapid tests. And while that's good, if someone is symptomatic, sore throat, cough, fever or whatever, they should get the rapid test, because right now PCR tests, getting appointments for those are taking some time, and it takes 24 to 48 hours. And in some places, because they're so backlogged, it takes up to maybe 36 hours before you get a result. So having that rapid test is a good a barometer to have. It might, if it comes back positive, you can tell, that child, like, you need to, let the parents know that they've tested positive. They need to isolate for 5 days and attend school virtually. And again, those, I'm assuming that those capabilities are readily available at all schools. So, and I understand it's very frustrating that, if the rapid test comes back positive and the PCR comes back negative, what does that mean? But again, we want to err on the side of caution, because it's possible that you could be asymptomatic and just be spreading COVID as a super spreader without even knowing it. So if the rapid test comes back positive, which student to isolate, and you can also identify, if students are sitting in close proximity, you can say, Shafiq, they may have also, they've been exposed to, a student, so they also need to be isolated as well. So it helps, but I wouldn't dismiss the rapid test at all.
And just though, Shafiq, CDC's guidelines still indicate that a close contact is if they were wearing their mask properly and they were still within 3 to 6 feet for more than 15 minutes in an enclosed space, they're not considered a close contact that's been compromised. I wonder if that remains the same with Omicron, because it is more transmissible. Somebody was saying, maybe that means that there's more particles in the air that can get in, all of that stuff.
Yeah, I mean, there is that possibility. And again, it's possible that, you can be in the same room with someone, and again, like for example, when I tested positive for COVID, my wife had already gotten the booster a few months before. So she tested negative several times, because through work, she needed to prove that she, was negative for it. So she ended up getting a couple PCR tests, each came back negative. And that just shows the importance of getting this booster vaccine. So yes, you are correct in saying that if I am in close proximity, that, it's possible that they may have not been exposed to it. But again, we want to treat any sort of symptom where it's, may seem like it's cold-like, flu-like, whatever. We want to take those cases seriously, because at this point, the number of flu cases are very, very small. We're seeing predominantly Omicron and Delta variants. So those are you have a severe version of the of COVID, and a highly transmissible but not as severe version of COVID floating around. So this will make things very difficult. But again, be cautious, take every precaution you possibly can.
Sister Aisha, Assalamu alaikum. I see your hand raised. Aisha Mirza.
Wa alaikum assalam. Thank you. Thank you, Dr. Tariq. Thank you, Mr. Ahmed. Greatly appreciate your time. And Ms. Shahzad, thank you. I have the question is the same. You already answered most of it. So we have kids which are 24, 28 in one class, jam-packed, close together. In the COVID year, it was, we teachers, I'm a teacher, we went crazy. We were doing online and we were teaching on campus. And this year we said, no, that's not happening. So they're all in the classroom. Beginning of this year, I had in my biology class every day 3 to 4 COVID cases happening. And they quarantined the whole class for 2 weeks. But then again, as it kind of moved along, students used to disappear. The teacher was there because you're in Islamic school and you're not teaching one course, you're teaching so many courses. So my concern is, what protocols should we take when the kids are coming back? I understand PCR test rapid, but other than that, in a classroom environment, when they're so close, and if they're there for 55 minutes and I'm 3 to 6 feet, teacher is close to them, they're close to them. So what are the precautions as a teacher, a person could take? And especially in lunch, I know we try to isolate them, but now they're sitting face to face to each other. So I think it will be like a bombardment of this happening no matter what we do.
And Aisha, where are you located? And
Orlando, Florida, I apologize.
And your school requires masks?
Leaders Preparatory School, yes, and we do require mask. We do. But I know so many traveled, and I know that they will be back with something, and I know they will disappear. And the teachers still continue to teach. Even if there's a COVID in the household, what happened was there were parents and teachers with COVID in the household, but if they were vaccinated, they were still coming to school.
Well, and that's aligned with the CDC guidelines.
Yeah.
Dr. Anam, like that just confuses me. I don't.
Yeah, so I mean, first of all, I think I really want to recognize everyone who is on this call. Mashallah, you guys are doing such a great job. I don't think anyone tells you how appreciated you are. Like seriously, teachers, mashallah, you guys are a lot. Like I cannot believe how much you give to the students and to your own families, but the amount of time you've spent and going back and forth with this COVID situation must be so much more frustrating. So at the end of the day, please don't give up hope. I think you guys are doing an amazing job. Things are going to happen. And I think the best way to look at the scenario, if you love to look at just hope, is that whatever you do, despite whatever you do, Allah subhanahu wa ta'ala is going to, be the ultimate person. If you're going to get COVID, it's going to be on his terms, right? So don't blame it on anyone. It's just going to be on his terms if it ends up happening. The other thing, though, I think, Aisha, you've mentioned, which I think is very interesting. Everyone's going to be coming back from these holidays and somebody's going to have something. They might not have COVID, but they could have a cold, or they could just have a simple, strep or whatever, sore throat. It's interesting to look at what New Zealand did when the pandemic first started and the countries that did like full isolation. So what happens is a virus has like a hill almost, or like a peak time, and then it kind of comes down. So New Zealand basically put everybody in lockdown in a very specific time period so that it doesn't matter, at what point they contracted the virus. It's just that they wanted to control that peak time and then basically start opening up when everybody was coming down that hill. So in terms of the school opening back up, again, if we don't have testing, or if we do have testing, but it's like a mixed version of the test, some people are coming back positive, some are not positive. If you want to just start out with a simple baseline, I will empower you guys to decide how you think is a good idea to go safely in terms of this. But what I want you to understand is everybody's coming from a different place. So you do need to consider that start point and the first day or first week of school as being the most important time if you want to start everybody from clock zero, and then have them come back into the school setting in person where they might be close to each other's faces or whatever to be safe. The other thing that I think you mentioned was important is that you have 3 teachers and you're teaching 3 different things. Like, how do you go back and forth with the virtual concept? I'm sorry, like, I don't think I can speak much about that, but what I can speak about is the healthcare setting. So for example, if somebody were to get COVID when we are at the hospital from a patient, if we don't have symptoms, because already the demand is so, we don't have enough doctors or nurses already there, and it's just so much work going on at the hospital, we choose to still come in to help the patient by putting on our PPE, if we're not showing symptoms. If we're really sick, we have fevers and chills, and obviously we can't do our work, then we're going to have to take off. But what I'm trying to get to you is that that's one of the reasons why the CDC kind of changed its guidelines recently, is because they're trying to consider the peak time when you would be considered infective, but when you're also coming down, and to help make sure that the demand or the force of people who are helping is still there. Because if everybody calls out sick, then again, we're going back to the situation where kids are not learning from online environments, or there are not enough doctors or nurses or other people in the hospitals, so it's just it's a tough balance. I don't know, Shafiq, if you want to add something to this, but I'm just trying to give you scenarios to help you understand how you can empower yourself to do what you think is best for your school, because there's not just one single idea or protocol that's going to fit everyone's school regimen today.
Yeah, no, Anam, I concur with you. It is, you guys have been put in a very difficult situation in terms of being and playing, teacher, physician, healthcare provider, all of it wrapped into one. So there's a lot of, understand that there's a lot of stress and strain on you guys, and especially if you get sick, you have to be home, and that just takes, it's very complicated. So, while we encourage, getting tested and things like that, I understand that it can be frustrating because you might take a rapid test and it comes back negative. You take the PCR test, that comes back positive. What does it all mean? The rapid test, was designed to be able to, test population at a very faster rate. So it's, it may not be sensitive enough, but it could be but it can be designed to be specific. So it is a challenging balance to try to make. So that's why we encourage people to get both the rapid test and PCR when available. For students who are coming in sick, who have the symptoms, and it could be anything that's, cold or flu-like symptoms, where it's sore throat, fever, cough, runny nose, you have, just do your best to play it safe. And I know that takes away from the education of the child. And oftentimes it puts a strain on the parent because they may be working and may not have anywhere to put the child for additional care. So it is very difficult. And, again, I reiterate what Dr. Tariq already said. I applaud all of you for doing the best you can with whatever limited resources you have and what you have. So, yeah.
I just want to thank you so much. I want to acknowledge Heba's comment. Are we noticing that, or question, that Omicron variant is known for specific symptoms? One of the struggles in a school setting is that every symptom can seem seemingly COVID, and living in a place with high allergens. Like, we have allergies all the time. And one of the things that I was reading about this variant is that it does appear as, it does present as allergies a lot of times.
It does. I think I want to echo something. Adults can have different symptoms than children. So children can just have simple runny noses at times, or they can just have like a little bit of a cough, a dry cough even. But if they're complaining of headaches, a little bit of blurry vision, or like obviously change in taste and smell, those are very specific to COVID virus and not so much the other viruses. So if there's an adult that presents with that in the same household with the children, it would be a great idea probably to just, think in the back of the head that maybe I should watch my kid too, because they might not present with the same symptom. But if one adult in the same household has it, it's likely that it's easily going to be transmissible to that whole family. So that's one way of kind of keeping in a theory, I guess, in a sense, and I'm trying to understand family-wise, how can you kind of control the situation if you cannot tell which symptom is which? And obviously, again, testing is limited. But then the other thing is, if the kids are presenting with, a simple cough or cold, masking up has been shown to be really effective, really effective. And again, if they're asymptomatic and they're masked and they're not taking off their mask, and then they're trying to be a little bit socially distanced, and you have ventilation going on in your school, there's going to be a good chance that you're protecting other kids. So I want you to feel somewhat of a reassurance. I don't want people like freaking out. That's one thing I want you to understand from this call.
Brother Fawad, do you want to unmute and ask your question? I saw you had asked something.
Assalamu alaikum wa rahmatullah. We have a family who has, the whole family has tested positive. They're in quarantine right now. We are requiring all faculty, staff, and students to give us a negative PCR test before coming back next week. Now the family is asking, because it happened during the winter break, they're just finishing their quarantine, I think yesterday, or actually today. So is that PCR test still going to show that they are positive, or will it be negative? Because we've heard that the virus can stay in the body for even up to 4 months after that. Thank you.
Sure. So the PCR, even if after they are out of quarantine, and even if the symptoms have gone away, it is possible that the PCR will show whether it's positive or negative. The PCR is much more accurate because it's whatever it's picking up, it's amplifying the RNA, and it allows a higher degree of sensitivity. So if it comes back negative, then that's a good assurance that they aren't infectious and they could return back to school again, but following the same protocols of masking up and washing their hands and things like that. But if they do come back positive, then I would recommend that they need to wait a few more days and get tested again. I'm not sure if there are specific guidelines out there in terms of how many days they need to wait, but I believe it would require an additional follow-up test.
So they do have to take that test, because I think that was their primary question, that
Yes.
do we even need to take this test?
Yes, I would. Yeah.
Okay.
Thank you. Because there's something that's called viral shedding, and that just means basically that you can still be releasing that virus, even after the symptoms are gone. So it could be 1 to 2 days. It could be longer than that. And like you said, it's possible that it could be in their system for a little bit of time.
And when it's in their system, they're still able to transmit it to others. That's the whole point. I think that would be the key point of communication, Brother Fawad, if this is a family that doesn't want to get tested, like, hey, we're all better, we just went through this. But I have heard of people testing positive for long periods of time. And then that's obviously not possible either. You have this family, by the way, also paying tuition, add that into this whole mix. It's not the public school system where it's free. There's all the other things happening with the family, keeping those kids home, that ends up being very difficult to be firm on that. Sister Tammy, Assalamu alaikum. Do you want to unmute and ask about your question regarding the contradictory results?
Assalamu alaikum. Sure. I'm a little sick myself. As the brother mentioned, I have spent the whole winter break quarantining. I'm currently quarantining. And I know it's because at the tail end of our school, we ended on the 22nd. We had many kids going out, and I did not get my booster in time. So I do agree that that is a huge, huge thing that we should be emphasizing. We actually, we're in Bridgeview, Illinois, so suburb of Chicago. We made the decision that when we go back, we are asking every child to be vaccinated, 5 and older, or they have to be tested weekly. And we've worked with someone who's been doing testing, and up until now it's been voluntary. And we just, it's, the rates are very, very high. But the confusing thing, and I personally experienced it, is I was highly symptomatic. I went and got both a rapid and PCR, and I've gotten conflicting results, negative, positive. I am sure I'm positive. I've had every symptom under the sun, and very, very unwell, but yet I have 2 negative results. So how do you reconcile that? And then I went to my doctor who did a rapid, and then I'm going to do another PCR. It's just, I'm very confused about what's happening and how I would reconcile that for my students.
So here's what I have to say, because and I'm going to use my wife and I as an example, because I had tested positive, my wife had tested negative, but she has this really bad congestion, sinus infection and things like that. So because we're in the winter months, there are multiple viruses that are floating around. So there's something that might affect children. So one could be RSV, or respiratory syncytial virus. You have your regular seasonal flu, which compared to last year we didn't hear any cases of the flu, because one, we were following very strict social distancing and masking guidelines, and it was a very mild version of the flu. So we basically had 0 cases, or close to 0 cases of the flu. This year is a little bit of the opposite. This year is a little bit more, and I'm going to put it in quotes as severe. It's worse than last year, or so you are seeing cases of the flu. You are seeing cases of RSV, which is also known as the common cold. So it is possible that you have either the flu, which will show up as PCR negative and rapid test negative, because it's a completely different virus. It's not going to show up on either of those. So there is that strong possibility. You could ask your physician to give you, to test you for the flu. And if that comes back positive, then you have your answer, that you don't have COVID, you have the flu, which is just, making you feel horrible and sound horrible at the same time. So I want you to understand that there are multiple different viruses that are floating around, and they have very similar symptoms: fever, cough. But the thing that differentiates COVID from the other viruses is that loss of smell and taste.
We only have about 10 minutes left for the official time here. I did see, Salam alaikum, Mariam, my friend Mariam is on as well, and asking, are you guys recommending a delayed start to school? I don't know that you guys are comfortable to recommend any of these things. Anam or Shafiq, I did want to at least say in reply to that, Mariam, that we did have an email thread on the IEC and ISLA's email listserv about what schools were doing. And this hasn't come up yet by any of the speakers, but many of the schools did decide to delay the physical reopening of their schools for 1 to 2 weeks. This is something that we've seen many school districts, public school districts around the United States have already made the decision to do. Some were already virtual before winter break because they were seeing an uptick of COVID cases. And many of the Islamic schools within that locality also decided to follow the district lead. Of course, we are private school leaders, you guys, and as the Islamic school leaders here, you are very much under your right to make those kinds of decisions. I know, of course, it comes with a lot of different things that you're considering, as one of the sisters here spoke about, just, the exhaustion from doing things virtually. So is there anyone here who is a school leader who would like, okay, so Mariam, I wasn't sure if Dr. Anam's comments regarding New Zealand's implied recommendation to restart, if you were implying that, that we should also restart to avoid that curve. So watching the curve.
Mariam, I just wanted to add, like, again, the CDC is not going to recommend how you do it. And again, as Shafiq said at the very beginning of it, it depends on the state, and it also depends on your local, health department or government. So first of all, I would follow their guidelines to see what are they really recommending, because every state and every little local city is going to do things differently. But two, I gave you the example of that as an idea because we understand it as like, okay, this is something that worked before, where some other country tried it, and when initially they didn't have vaccines and they did not have any testing. So that was just an idea to help you understand, like, okay, there is a way to go about it in the situation where we have limited testing, or if we are not really sure of what people's statuses is. I just want to add to something that was just said before with Tammy. Tammy, inshallah, I hope like you recover soon and you feel better. Just to give you some positive, again, I like to look at the positive in situations where there's a lot of negatives, is that any type of virus that you get does make your body stronger. So even if you're having a longer time period right now where you haven't, gotten better, it actually means that your body is making it in itself stronger to protect you from a future thing that could happen. And it does not have to be COVID. Now, given that there is something called long COVID syndrome, I'm not sure if you have it, but I think I just want to address it in case, you guys do deal with children. So there is a situation where even if the kids tested positive, they might have some longer situations where they're negative now, but they're feeling more tired still. They don't feel back to their 100%. And that is a syndrome that's, I don't know if it's called a syndrome right now, and Shafiq, you can correct me. I know that the NIH is looking into this, but it is something that is there. These kids should be able to go back to school in person. I don't see a reason why they would actually be infective at that point, but it just means that they're not back to their 100% because their bodies are not feeling, completely recovered. So that is something to just understand, that if they are feeling like they still have some fatigue or they still have some lingering cough, dry cough, whatever, that it could be a result of that. But also any other viruses, the ones that Shafiq mentioned, and believe me, like, I think it's, maybe we don't understand this, but if you put your kid in daycare, they're going to catch everything under the sun. They're a petri dish of getting germs and bacteria and viruses. So what we're having right now with this, winter months, but also with a mixed picture of COVID, is that these kids are petri dishes. They're going to catch something. Do we need to be afraid of COVID? We've already addressed this question by saying, if you have testing available, you can easily test for that. But then some people will continue to have some of the virus shedding, and that's okay as long as they're not in that infective cycle. And then their household seems to be asymptomatic, or they're not having any more symptoms. So that's a good sign if that's the case. I hope that helped. I know that was like a long story, but I'm just trying to give you more scenarios to help you guys being empowered how to deal with this.
Asia is asking other administrators, and definitely guys, feel free to unmute, turn on your cameras as an indicator that you'd like to share out. What are you doing in your schools to prevent the spread? We've heard a lot of people here today say that their schools are requiring negative PCR tests, test results, or some are doing rapid tests, drive-through rapid test. That's something my school is doing too. Are you requiring this regardless of vaccination status? Asia, in our school in Austin, Texas, they are requiring it for every single person, regardless of vaccination status. Anyone else?
Thank you.
Hey, Assalamualaikum, Asia.
And I just want to make a quick comment about one of the questions that keeps coming up is, well, how do we know whether to delay the start and whatnot? While I'm not trying to give you a specific recommendation of how to do that, but if you see a large number of students who are returning from the holiday break testing positive for COVID to the point where it's going to create a safety issue for other students who are testing negative, then I think it comes to the discretion of administrators of whether we delay reopening schools for it. But again, that is a very difficult decision to make, because I know there were some schools, and I live in Maryland, so there were some counties, a county, Prince George's County, where they were seeing, I think, up to 20% of their students testing positive, but leading into winter break. So they ended up closing schools for a few days before the winter break. So now I know, now you're at, the question is like, we're coming out of winter break, can we still do that? So that's something that's gonna be left at the discretion of administrators. If a large percentage of your school is testing positive, that means that it's gonna be a greater risk for students who haven't tested positive, and a risk for them to be carrying this virus back home and spreading it even more. So there is no magic number to say like, oh, is it 20%? Is it 30%? Is it 50%? I don't have that number, and I don't think there's a specific number that you can use. Again, that's going to have to come at the discretion of the administrator and educational leaders.
And Shafiq, there are some thresholds that schools are using depending on their localities about, for example, a certain percentage of students and a certain percentage of people in their school building testing positive, or if there's, for example, multiple classrooms at the same time. There was one school that I was speaking to last week about if there's 3 school classes that have COVID across the school at the same time, then they decide to go virtual for a certain amount of time. Nuskia, with the last question, and then we'll wrap up, and we as administrators can say, we'll say salam to our panelists and thank them for their time. Go ahead, Sister Nuskia.
So basically, I work with the age group below 5. So my question to our panelists is, in addition to everything that we have done so far, requiring the mask, having the daily health checks, having everything, is there any additional precautions that need to be put into place? Simply because, they cannot be vaccinated. Is there anything else that we can do in a school setting to, prevent, inshallah, anything from their end?
Yeah, Sister Nuskia, very good question. Honestly, you're doing what we would think is the right way to go. I have one under 5, so I'm doing the same exact things. I don't think you need to get weekly testing for your facility. If you have kids under 5, as long as they're doing the masking, you have HEPA filtration, or you have some kind of ventilation going on. I think the biggest thing you have to understand is the reason why we wanted herd immunity is if these kids are not vaccinated, everybody around them, if they are vaccinated, then they're actually protecting the kids, right? So again, if their parents are vaccinated, if you guys are vaccinated, and in the school system itself, when the kids are there playing with the toys, if you're sanitizing those toys, and you're keeping the ventilation going, those things are the best way to go right now.
Jazakallah khair.
And I agree with that. Yeah, again, sanitizing, keeping, things clean as possible is going to, prevent the spread of this virus.
And Shaza, can I add one more thing? Sorry.
Of course, no, please.
I think we just didn't emphasize this one. I'm going to send Shaza a couple of links that she can share with you after this session is over. But we didn't really highlight the kids aged 5 through 18 getting vaccinated. We've been talking about this, but I'm honestly telling you, it's a big deal if your kids are vaccinated, because kids, mashallah, when they get even one vaccine dose, they have really good antibody responses, okay? And I think it's, in terms of understanding, I know there's a lot of conspiracies out there, and there's a really good Imana video that you can watch where we have some, experts who've looked into this, is that it's not the fact that, the kids are getting something very strange. They all have to get a hepatitis shot when they're babies. They all have to get a Tdap shot. So it's just another vaccine that they're getting for their body to recognize what's going on. And then again, mashallah, even though that the kids are protected at times and they don't get severe symptoms, you don't want to be the reason that your kid, was hiding a virus that caused another family member or a loved person who was immunocompromised and on steroids or taking other medications that were chemotherapy medications to get sick. Because when that person, because I deal with a lot of patients who have kidney disease, but heart disease, diabetes and whatnot, these people have gotten their vaccine and yet they are still getting the COVID and get really sick and end up in the hospital because unfortunately, they don't get the same level of antibody responses that us people can get or the kids can get. So mashallah, the kids are a blessing from Allah subhanahu wa ta'ala and may they always be protected. But you guys all have to, I would say, educate the parents of these kids how important it is for their kids to stay protected and to protect their friends, because I know how earnestly kids want to play with their friends. And if they want to play sports or if they want to be next to each other on a lunchroom, just talking to each other, that's the way to go with the vaccine situation if they had not already started their vaccinations.
Any concluding thoughts? Thank you so much, Dr. Anam, for stressing that point. And Brother Shafiq, any concluding thoughts before we end?
Yes, please get vaccinated. Even if you're in a public school and the public school is not requiring vaccinations, get vaccinated. Do it for yourself, your family, your children. Again, if they're under 5, then they're not eligible for the vaccine, but please get vaccinated. You're only, protecting you, your family, and others around you. And when, again, it is possible we may need another booster shot in 6 months. It's, I'm very needle phobic and this did not bother me at all. So if we're required to get another booster shot in 6 to 8 months, I'm going to do it because, I know my risk factors. I know my mom's risk factors. I haven't been able to see my mom, who literally lives 5 minutes down the street from me, in almost like 2.5 weeks because I tested positive and she hasn't been able to get her booster shot. So I'm telling her the same thing, get the vaccine. If you haven't been fully vaccinated, please do that as quickly as possible. If you're in an Islamic school and you are able to encourage your students and family and their families to get vaccinated, please encourage it, because that's actually a study that was done by ISPU that showed Muslims also have a huge vaccine hesitancy. And that's something that needs to be addressed because we as the Muslim community also has high risk of blood pressure, heart disease, and other risk factors that will make this virus more lethal to our families and loved ones. So I know that's more than a few thoughts, but please get vaccinated. Jazakallah khair.
Thank you so much, everybody, for joining us today. We wanted to be able to provide you with the opportunity to ask your questions to trusted Muslim medical and public health professionals. And we're so happy that you all have taken time out to join from your winter break. I know you've been thinking about, perhaps you've been working about how to reopen your school safely. Jazakumullah khairan for everything that you do. All of the educators here, really, you guys are frontline workers and you've done so much research, so much you've been learning about in a field that's not all of our expertise. So Jazakumullah khairan. I will actually keep the meeting open for a little bit longer, but I want to thank our panelists, Dr. Anam and Brother Shafiq, for joining us and sharing so much beneficial information, answering the questions to the best of your abilities and knowledge. We really, really appreciate you. Thank you so much for being here. And we will be sending out this recording and some resources, inshallah, in the following days, inshallah, in the next 24 hours on the IECN. If you're not on the IECN, please join so that you can stay in touch and ask questions. You can sign up here. And I will keep the meeting on. As I said, I'd love to hear from you all and share out a little bit more if anyone has any more questions, or I'm here just to talk with you guys. I miss you. Assalamu alaikum wa rahmatullahi wa barakatuhu. Jazakumullah khairan. Thank you so much, Dr. Anam and Brother Shafiq, and everybody who's joined us.